Thank you for inviting me. And I think I'm going to speak a topic that is not really popular or very well known. So I will try to be explaining the most I can without not getting into too much deep. So as a disclaimer, I want to tell that I don't have any conflict of interest, and none of the companies that I might mention in these slides did pay me or something like that. It's gonna give only examples to give more details about oral health and virtual reality. So I want to start, and I know that the whole day we have been talking about metaverse, but to give a little brief explanation to get into the oral health and metaverse, is that the word started as a mix between the transcendence, that is meta in Latin, and the verse, that it means to universe. So it's a merge between the two words. And as interesting, the metaverse integrate different technologies. It's very integrated, and we have blockchain integrated, artificial intelligence, networking, interactivity, and digital twin. And in those technologies that are the ones that I'm going to talk today, we have virtual reality and augmented reality. So as I explained better, the metaverse include all these technologies as a very big circle, including digital twin, computer vision, the cloud computing, also the avatar, blockchain, that is used very much in electronic dental records and electronic health records, and all what is augmented reality and virtual reality. So the word metaverse started with, and was first coined by the author Neil Stephenson in his classic science fiction book Snow Crash, that was published in 1992. And then it was the first one that, as it is not a clear definition, but is called as a persistent digital world that is inhabited by digital twins of people, places, and things. So I found interesting to make the difference. Maybe it could be a little bit basic, but for the ones that don't know, the difference between augmented reality and virtual reality. The virtual reality is more in relation with a completely fictional reality, and you require specific devices like virtual reality headset, and you are immersed in a fully virtual environment. In the augmented reality, you are enhancing the real world with digital overlays, and it allows the users to remain in the real world and can enhance, as I said, the real world and the virtual environment. So you can see in the slide too the difference where you got the virtual reality, the person is completely immersed like in another dimension. The augmented reality, normally with the use of wearable or other devices that help to enhance the reality. And you got the third modality, that is the merged reality, when then you start like interacting directly physically with this virtual reality. So directly, what is in relation with oral health? We are now in the fourth educational revolution that is enabling all the healthcare students to be immersed in this digital technologies such as artificial intelligence, virtual reality, and metaverse. So in the cases of metaverse uses in dentistry, we got that one of the important uses is establishing virtual health clinics, established also in aiding with telemedicine, or in our case with teledentistry, in offering 3D digital imagery, and in revolution the patient care and procedural precision. That means also in enhancing safety and quality and humanization in healthcare. So what applications we got directly in dentistry? Well, basically it's the assessment of knowledge, like the help of the metaverse and the use of these technologies, virtual reality, teledentistry, augmented reality, can help and give guidance to children, especially with education in oral health, with interactive games, and also very important for dental trauma, especially in children that are in their 80s and until 12 or 30 teenagers that normally tend to have more dental trauma. So with this immersive experience and interactive experience, they can teach practical skills to do preparedness, to enhance the guidance of in the school or with the teachers or with the parents, how to interact if they have this dental trauma, because you have only 1 hour to act very, very fast in the case of permanent tooth. If, for example, you got an avulsion, and also before that, to give knowledge to the parents, teachers to know how to behave, and also to the kid to understand in a very funny way what can happen. So in relation with also these games, we got that, for example, some brands have made like these games of tooth saver brushing games that can be used in the iPad or in the smartphone, where there are images of different anime characters with time guiding the kids to brushing their teeth and engaging them in this game to gain some points if they're doing it okay, and watching at the same time a funny series. So the oral hygiene practice can be enhanced in the children. Also, too, another brand that has done these games is Happy Brushing Disney Magic Timer by Oral-B, and they can choose with what toothbrush they're gonna use, and so they enhance again in a habit of brushing their teeth. So, and now going directly with the basic learning for dental students, we got that the benefits of the metaverse-based oral health promotion in children can be the personalized education, the increased engagement, the accessibility, the improved oral health, and increased confidence that is cost-effective, that is funny and interactive, and you can monitor and track the progress too. So at the end, it gives more engagement to the patient and also to the caregivers. So different strategies has been implemented to this oral health promotion in children, and the education training is one very important. The integration in the school curricula, always the continuous monitoring, the collaboration with different dental professionals that can be involved, and always the feedback, the research and evaluation, and the address of equity and inclusion. So also metaverse application in dentistry can be used too with teledentistry. So we can promote and revolutionize remote healthcare by enabling 3D virtual clinics. So the problem with the teledentistry now is this experience for the patient a little flat. So flat would I mean like 2D, but with the metaverse or virtual reality or augmented reality, teledentistry can be more like telepresence. So the patient can interact more directly with their own condition in oral health and be engaged more. So also can help to these constructions of virtual clinic with the different avatars where the patient can go and be treated by different specialties and give advice or have a second opinion consulting. And that obviously helps in going beyond the geographical boundaries, so it can create a better telehealth experience. We got that these virtual clinics reduce obviously the need for in-person visit. We saw that during pandemic when there was been doing triaging, dentistry profession was really impacted during COVID times. And also a topic that is very global, that is the long waiting list in the different hospitals, different public hospitals. So to concentrate all the patients not together in the tertiary care, just before in the primary care. So the only urgent patients go to tertiary care. And also very important too in dentistry to diminish the risk of infections, especially during the outbreaks. And obviously the virtual approach can enhance the safety and maintain the quality of care, because some of the surgical procedures can be pre-done before the real ones. So another thing that is oriented with person-centered care, that is also a model of dentistry too, is that augmented reality can help in dentistry for communication with patients and treatment plans. So when you start showing the patient in a very understandable way, 3D, with videos, image, or involving the patient with all the treatment or dental treatment plan that you want to do, and he can see it physically and understand, obviously that helps a lot and minimize the numbers of visits, save money for both time and for patient and dentist, and also give better prompts or reported outcomes for the patient too. So the use of artificial augmented reality and virtual reality in dental care can offer to improve accuracy in treatment planning and enhance patient satisfaction. So the different use in virtual reality and augmented reality in dentistry, as I said, are specifically in oral surgery with the use of, for example, 3D overlays to do correctly the inferior alveolar nerve block. That is a very important anesthesia we use in oral health. It's used for almost everything, especially for the low jaw. And a good anesthesia of that nerve is a must for working. If the nerve is not adequately blocked, the patient will have pain almost all the dental visit, and we were not going to be able to work. And as we have some certain percentage of patients that are delayed in anesthesia in this nerve, this is very important for training students and to see exactly where the nerve is going. For implant, guided clinical surgeries guide has been very successful to do before a preview of how the surgery is going to go exactly in the right way. And for orthodontic treatments, for planning how it's going to be, for patient education, obviously, and oral hygiene maintenance, for stress, anxiety, and pain management of different patients, not only pediatric. We can add also patients that are adult too, that had phobias, and we can also add patients in the autism spectrum disorder. And for what is prosthodontic rehabilitation, we have already designs of crowns, bridges, cavity designs, preparation, root canal location in endodontic treatment, and obturation accuracy of the fillings. So, as I said, augmented reality in dentistry serves to do treatment plannings, and with the aid of computer vision and augmented reality algorithms, this technology can help so the patient can see exactly what the treatment is going to be and the result is going to, a proposal result is going to be. So no surprises. And for also the treatment planning too, there is an app, augmented reality app that is from the Smart Tech company that can help the patients to see what is the smile he's waiting for or what he's expecting for, given a more aesthetic view for the patient. So he has a good idea, and it's not only the idea of the dentist, what he wants to get. And in education, as I mentioned, in different specialties of medicine, but in relation with dentists, augmented reality is becoming very important in all what is the educational phase of the dentist. Specifically with different systems, for example, Dent System is a simulator that combines the augmented reality with a mannequin. Normally I was trained only with a mannequin in my time, and with this mannequin and with plastic tooth, we did our training to then pass to the clinical phase. But now the students are being trained with these two technologies combined. So they can see in the computer how they are performing and how much distance it is, if it is correct. And then there is a feedback. So they interact at the same time with the augmented reality. So these faces are overlaid, and they can see how they are performing, if they have to do more deeper, if they can go more wider, or if finally they have to change the tooth because they already passed the nerve and it was not really the work very well done. So I have an example here. So you can see, for example, the tooth, how it's been deep going in the cavity. The optimal, and the one students normally are very shy when they start because none of us want to screw it for saying the thing. If the tool is going too much deeper, we're going to go to the nerve. So it has to be like we go very, very slow, and then you got the figments. So the dance sim is augmented reality with this training simulator, and with the student doing the preparation, and the performance is being like telling you exactly, okay, you go more to the isthmus, you need to go more deeper, and then it gives you the millimeters that you have to keep continuing on. So also for augmented reality for education in dentistry, there is another brand called Simodont that is using also intraoral scanner, and it's also for preparation of cavity in teeth. And so gives similarly the same experience of feedback when you're doing the preparations. And for oral surgery, that normally is very complex and is a mixed specialty, not only for dentistry, also for medicine. They got the mentor eye system that incorporate this vertical surgical plan, and is a head-mounted wearable system that with augmented reality gives the option to not use waferless maxillary repositioning that normally needs to be used in these oral surgeries. So give a more precise and cost-effective planned surgery. And different systems are also that I will not mention now, but we got in the different fields of dentistry, in operative dentistry, in general dentistry, in periodontics, that goes for the gums and the bones, and maxillofacial surgery for doing cavity preparations, caries removal practice, teaching of dental anatomy, training different periodontal procedures, and third molar extraction. So this potential use of virtual reality now, I pass augmented reality. In virtual reality, can help a lot too for potential in dental education when you submerge or immerse fully in this artificial environment and offer different experiences to the students and the professional. For example, for the students can give the idea also in medicine to be a little empathic of how the patient will feel. If the patient will feel pain, if the patient is anxious. So it helps to give more empathy. And for the dental professionals to help to other colleagues in different specialties to guide the ones, for example, that are in another regional area and do not have too much skills in a specific area, so they can be guided. We got different also potentials relation to observe in education surgeries in person at distance, like a learning experience. And also, I want to highlight here that in 2015, Nobel Biocare performed the first dental surgery filmed in virtual reality. So dentistry was very innovative in that area, more than 9 years now. And so virtual reality, as I said, can foster empathy in dental students when they immerse in the patient's perspective, and can also help so in improving the communication between the dentist and the patient. So another technology too that has used it as virtual reality in dental training system is one of the novel technologies that combined with the Harvard School of Dental Medicine, focusing this to help the dental students to do proper virtual reality preparations of cavities. And they replicate with this software different dental instruments that are required for restoration. So the haptic simulator resembles the different instruments that we use for removing caries or the drill. So the student can regulate exactly, because you need a very fine motor skills when you're starting, you are not really used to. And that helps you immediately with feedback, so you auto-regulate yourself and you know exactly what amount of force you have to use. There is also an application for this too, for one skill that's very difficult to learn in dentistry, that is the mirror, because we all work in mirror phases. That means also when you're seeing x-rays, you have to like inverse. It's the same with the mirror, especially when you're working in the upper sector of the mouth. You have to reimburse everything, and that takes like approximately 3 years. So with this, it has been seen that enhance and it gives less time of training time for the students. So as I said too, on another brand that used to virtual reality is Dentified, that combined simulating dental drilling with this haptic technology. And then the Capernaum and colleagues reported an increased effectiveness using this haptic-based technology in preclinical practice in endodontic microsurgery procedures. And also Chen and colleagues validated augmented reality too in these guided endodontics microsurgeries. So in different specialties that require surgery and require more fine motor skills, this technology has been validated as a very good aid. So we got here an example of how a planning orthodontic surgeries can be. In the past, normally if you see in A, this is the first image, that was what an orthodontic specialist or orthodontic has to see before. And it was only a flat image, two-dimensional. And then we passed to B and C, that is three-dimensional image. That's normally what we are using till now to do the planning of an orthodontic surgery in aid with the orthodontic specialist. And now with the help of the virtual reality, we got the virtual reality vision model. This is completely more 3D and completely holographic or alive, to say. I think that gives a more visual scenario to plan better the spaces and the movements that's going to have the bones and the teeth. So the gamification in oral health has been also used in adults, not only in kids. And in virtual reality, we got, for example, one that has been really successful and has like another copies, but the first one that started was Ficha Mobile, that is used as a physiotherapy in patients that have temporomandibular disorders. So this is very interesting because they don't use the normal headset virtual reality. They use like Google Cardboard, and then in that cardboard they put the cell phone, and you have to like customize the cell phone in a certain type of virtual reality, and then you put the cell phone and put the headset, and you start with the game. So in this case, you see that guy is opening the mouth because there are exercises to opening and closing the mouth when you have temporomandibular disorders. And the game consists in giving you certain type of food like bananas or strawberries, and you have to open the mouth every time that you see one of those fruits coming next to you. And obviously that gives you points for doing it correctly or not. So this is a funny way to help to engage the patient in exercise that normally are really boring to be truly. And the patient then remembers, oh, I'm going to play this game 5 minutes. And so he's helping in those monitoring this, his own health with these games. So now I'm going to pass for another interesting application of virtual reality for dentistry that has to be related with anxiety, pain, and phobias. So for a long time in medicine and in dentistry, all what is pharmacology has been used for treating this anxiety and pain. But now it is more movement to be a little more conservative. And with this conservative or non-pharmacological techniques to help to distract the patient. So techniques of distraction for anxiety has been used very successful, and there are a lot of them. In dental settings, you can put music that is it is shown that has worked very well. You can use a monitor TV in the roof for the kids or for patients. There are yoga techniques, there are a lot. And virtual reality is another non-pharmacological distraction technique that obviously can work very well. And also because this distraction technique, a difference of the others that are more passive methods, this could because give you more stimulations to your senses. So you got in this graphic that in terms of anxiety and fear, there are different fears that are there categorized of ones of the more prevalent. And normally agoraphobia is one of the more prevalent, but there are also, and you can see there, fear of needles or dental phobia. So the dental phobia could be mostly related because of the noise of the drilling, or it could be most of the times to the needles and to the drilling specifically. And to manage that is very difficult when you have a patient that has fear to the needles, because basically if you don't have the patient with anesthesia, you can't work. But there are patients that even is so much their fear that ask, please don't put me anesthesia, I prefer to have pain, that suffer the fear of the needle. So for these patients, this can work because virtual reality can give you analgesia. This is done with the influence of brain process pain signals. When you use virtual reality, the insula, the thalamus, the cingulate cortex get fewer pain signals. And interestingly, women, it has been seen that are less used to use virtual reality because they experience more claustrophobia and they need to have more control and awareness of what is surrounding them. So in terms of virtual reality for reducing anxiety during dental visit, this can be used also in the waiting room. It can be used, as I said, as a distraction technique. And normally the natural landscapes you can use to help that normally work really well, because those landscapes give more less anxiety to the patient, and also obviously give more satisfaction at the end of the dental visit. And then you can see in the image that the patient is being monitoring to see how their physical signs are, if he experienced less or not anxiety in comparison without the virtual reality headset. So they measure the skin odor, and also the rates of the heart and the arterial pressure. So in relation, as I said, with phobias too, virtual reality can help in reduce needle-related pain. That is a pain also to reduce the higher levels of dental anxiety. And in different clinical trials, it has seen that virtual reality works more when the anxiety of the patient, the dental anxiety, is higher. It doesn't work really well when it's moderate, but when it's really high, you can see a lot of improvement. And also the equipment of the virtual reality is important because it has been seen that the high resolution virtual reality contribute better to patient satisfaction. And as I said, also natural landscapes work better because they trigger more positive emotions. So in different clinical trials, it has been seen too, and I guess that is because of digital literacy, digital health literacy, and digital literacy, that younger adults found more interesting and are more prone to use the virtual reality headsets more than middle-aged or elderly. But funny fact is that elderly have claimed in different questionnaires that they like to use the headset, but they feel a little ridiculous. So there is also somehow a little of a shame, I don't know how to call it, because it seems something too futuristic for them. Some participants don't like to use the headset because, as I say, in the case of women, they need to have control. So they don't like to see what is happening surrounding them. And some dentists too claim that with the patients with the virtual reality headset, they don't have also direct communication or control of the patient because they are not looking at their eyes. So as you can see, this varies according to different personalities. And for dental phobia, it has been seen that can work really well because it does not require specialized training. And it's very flexible because when you're doing the training with the patient, you can stop, you can pause, and so it's more adaptable than another technique. And this virtual reality exposure technique, that is normally the technique that they use for patients that have different phobias, also can be do it for dental auxiliaries too. So it's very cost effective in terms of it can be done by distance using teledentistry. So it can be administered in different geographical places. And I want to mention in relation with anxiety too, what is relation, it can be applied also in stroke survivor patients. Stroke survivor patients are patients that have a lot of anxiety, and when they have to go to the dentist, they have it more. Precisely because of the consequences of the stroke, most of them have motor disabilities, so oral hygiene is not really well done, and this can be benefit them with educational purpose, but also for pain management because they have limitation in all the prescribed analgesic, specifically ibuprofen. So the combination of this dental anxiety and sometimes depression that they pass after the stroke and the restricted pain management are a challenge for them to use this technology that can help them in the pain management in the dentist and also in the anxiety to the dentist. So what would be the general recommendations for the developer of these devices in dentistry? Well, there are some issues. As the headset is too heavy, and the patient has not really a wide movement and he cannot move during the dental setting. So the idea is that the headsets are not really like bulkhead or strong, heavy. So because there are limited head movements. Also, the video selection is important because it has to be videos normally because the patient is reclined. Then the idea is that there are not completely, it has to be completely in the upper view quadrants. So it looks more in the upper side when it's reclined. So the video has to be customized in this so he can really see the landscape completely. Also, it has to adjust for light sensitivity because sometimes there are gaps in the nose bridge, so enter light and that distract a little the patients. Some like it, some not. And also because you can choose or give to choose the patient if they want to have it completely steer or let a little bit if he's a little claustrophobic to have the light. So also for oral cancer, I cannot not forget to mention that it will help you in diagnosis, treatment, concealment, and because also can help in virtual consultations for patients that are in remote areas. And incorporating the augmented reality in surgical procedures and tumor removal can enhance precision and accuracy to give real-time 3D visualization of the internal anatomy. Also because it can help in remote surgery that can allow different specialties to guide specialists to guide surgeries in areas that are lacking medical specialist professional or dentist professionals. And as I said, can help in this co-production work with different specialties that can help. And going with that, Metaverse 2 can help, like I said, in a globalization through virtual collaboration platforms of different experts and specialities that can enhance in some cases specifically and can help to this specialized care worldwide. Maybe in the future, we are going to see no barriers in healthcare and different specialties can collaborate in different difficult cases. Who knows? And that could be a very immersive experience of different specialties being referred between dentists, physicians, and other specialties that can interact with the patient. So briefly, I want to mention that Metaverse use two blockchain technologies, and this you can see it too in the dental records, ensuring patient data privacy. And what I found really interesting is can be used too in disaster victim identification, offering here a very humanitarian view, and obviously can help too in is the establishment of the virtual health clinics of teledentistry. And I have to mention, if that is not really like the idea, but I have to mention where are the drawbacks of limits of metaverse in our health. Well, basically the cost nowadays, because it's not affordable for everyone. Then we got also the screen time and health concerns relation with the use of the headset, so too much eye irritation if the time is not doing correctly, or red eyes or dryness. So the time has to be measured correctly. There has to be a lot of blinking, and it has to use sometimes eye drops, etc., because that could be also an issue in the children. And also, what is all privacy and cybersecurity? The guidelines and regulations of quality and privacy to ensure how it's going to be. Because as in telehealth, there are guidelines now, and artificial intelligence is working on that. So for these other technologies, we have to also be guidelines in relation with that, specifically with privacy and data security of the patient. So also, as I said, technical limitations, what is relation with the haptic feedback is okay, but still lagging a little bit. The integration, the interoperability, the cybersecurity risks, and the regulatory uncertainty that we don't have to forget because it's not completely done. And also what I mentioned, some fatigue or cyber sickness that can be used when you use the headset too much time. And what I say also, the virtual reality devices is the bulkiness that complicates a little the dental procedures to some dentists or to some patients. And I want to integrate also what is the role of the of metaverse in humanization. I am part of the Society of Humanization in Healthcare, Chile, so I would like to also talk about this a little bit. The metaverse has a very important role in doing a more personalized and patient-centered care, specifically because when there are involved of these technologies, artificial intelligence and haptic feedback, this give a more individualized interventions. And also because it lets the physicians, the healthcare workers to be focused more in the patient and less in the administrative area. So we let the administrative thing to the technology and we focus in the important that is the patient to be empathic, understandable, and get exactly what it matters most to him, her, or they. So the humanization role in metaverse, as I said, if you think as the metaverse as human-centric, you got the human is the objective, the applications, the ethics, and the technology. But you have to think that you are doing this for the patient, and the technology is only a server, a helper. But it's not, the center is not the technology. The center is the patient. And the inclusion role of metaverse. The inclusion role of metaverse will help a lot of different people, especially the ones that are in the autism spectrum disorder. They will understand the introvert preference, the ones that have sensory sensitivities, and also the ones that have disabilities, especially because you can customize the needs of different patients at the same time and will let different patients that have trouble to be more proactive socially. And in relation with patient safety, I have somehow mentioned it, but to resume is the cost effectiveness and efficiency. The preoperative planning gives you a lot of help to sentinel events because you plan the surgery very good to see whatever can happen. So there are reduced complications and lower costs at the end, and the training because the training is more accurate. And the future. The future for metaverse in healthcare can be so wide that it can include even training for astronauts when they're gonna be more for sure trips to the moon or wherever the place. So it can also help to train them at distance or to prepare them for any emergency in dental care. So I think metaverse and these technologies can be a great of help. There are being now, but could be greater help, especially for training people that has not skills and they need it as an emergency. So with that, I end. Here you got my LinkedIn if you want to contact me. And the last one, to rate my session.